Hi, I'm Dr. Dawson. I'd like to talk a little bit about allergies and eczema and asthma. These are three things that we know they're passed on the same gene, but the first few years, it just never made sense to me that these were related. You had one where you had a rash on your arm, you had another where you had, runny nose and sneezing, and another child that was having a wheezy cough and trouble getting enough oxygen. They just didn't seem the same to me at all. But as the years went by, I got to be thinking about what was really going on here. I think it makes a little bit better sense. All three of these areas are where your body first comes in contact with the irritants of the outside world. The easiest to picture is your arm coming in contact with a little bit of poison ivy. Almost all of us are sensitive to that irritant, and our body reacts by getting red, swollen, and weepy. Likewise, if your nose is a little too sensitive compared to your neighbor, to cats or pollen that's floating around, then your nose gets red and swollen and weepy, and you get runny nose there. Same thing in your lungs. If when this air, then we suck it down into our lungs, and as we're exchanging and taking the oxygen out, that's a pretty intimate contact with the irritants of the outside world. And if there's something in that air that our body is irritated by, it gets red, swollen, and weepy also. So all three of these are areas where irritants make our body a little bit red, swollen, and weepy. In the case of your arm, it will also itch. Your nose, in addition to being red, swollen, and weepy, will sneeze. And your cough, in addition to the red, swollen, and weepy, your lungs will cough because that's your lungs way kind of sneezing. So all of these are really just overreactions of our body. And the nice thing about this is that since the same mechanism is going on in all three places, the same basic treatment helps all three. And that is, if you can apply a thin layer of a steroid to those three areas, it will tell your immune system to just kind of calm down, and act more like the next door neighbor, and don't be so super sensitive to these things. And that's what steroids do. Steroids kind of tampen down the response of our immune system. And so in the case of our arm, we smear steroid cream on our arm. For our nose, we use a nasal steroid. And for our lungs, we'll use an inhaled, corticosteroid. And so the same basic medicine will work for all three. The main barriers to treatments that I see are that parents want these to be short illnesses. They want them to be like a cold or a stomach bug, where you may treat the symptoms for a few days and then they go away. The problem is these are genetic conditions and they're going to be around for a while. It may be like being short. You may grow out of it, but it won't be this year. And so if parents can accept that these things are going to be around for a while and there are conditions that will require some ongoing treatment, then they can be active in the treatments of these symptoms when they first start, and maybe even proactive, so that they can kind of nip the episodes in the bud. And so that really would help a lot. Once we accept that these things are going to be around a while, even though we may grow out of them, we can start being more proactive in their treatment. The other big barrier that I see is there's kind of a overblown fear of steroids. And I get that steroids, if used in excess or in too high doses for too long, that they can cause problems. And I started out this business with a fear of steroids. But we've had steroids in medicine for maybe over 75 years. And so we've used them a lot. We have a lot of experience and a lot of knowledge about steroids. And we know that if used in proper doses and for short periods of time, that we can diminish any side effects that they might cause. The problem with when you read labels and warnings about medications, the warnings are written as if it was for a case of beer. And we all know that if you drink a case of beer, there's going to be significant side effects and problems. But if your dose is only a thimbleful of beer, then all those side effects that go along with a case of beer don't really apply to you. And in the case of these maladies that we're talking about here, the dose that we're prescribing is just a thimbleful of beer. So you don't have to worry about the long-term problems. Those are not going to be a factor. The other thing that I've found is that if we really want to use the least amount of steroids, we have to use a little more earlier. When I first started, I avoided steroids too, and so I waited as long as possible to use them, and I would use the smallest dose that I could come up with, and we were treating these things for weeks at a time frequently. As the years went by, I realized if we used a higher dose and used it as soon as we saw that the episode was beginning, we could nip the problem in the bud, and even though we used a higher dose and we were using it right away, we ended up using less steroids in a 365-day year than if we tried to use as little as possible and the treatment for each episode drug on for a really long time. So in this case, using more early will allow you to use less steroids in a 365-day year. The other thing to keep in mind when you're considering a medication is it's not in a vacuum by itself. We're using the medication for an illness. This is not like the decision, should I take crack cocaine? Do the benefits exceed the risk? No, they don't. You should not take crack cocaine. But in this particular case, what about asthma and steroid? If asthma is causing your body to have the chronic underavailability of oxygen to your lungs and your tissues, that is far worse for your body than taking a little bit of steroid over a prolonged period of time. So in this case, the steroid is much, much better than the problems caused by the disease. For those of y'all that are parents that have a person that passes this genetic trait onto your children and are feeling bad about it, let me just say this, it's not your fault. The truth of the matter is you've always been this way. There's really nothing you could have done to prevent passing this gene on to your child. Your spouse, on the other hand, they could have chosen anybody in the world to have children with, and they chose you. So since you didn't have a choice and your spouse did, it's really their fault. So if they start giving you grief, you can just explain to them that it's really their fault. Now, instead of wasting our time figuring out whose fault it is or what to do about that, let's concentrate our efforts on how can we help our children both A, identify and diminish their exposure to the triggers, and B, use the steroids a little bit quicker. So the common triggers for eczema, since it occurs in the first few years of life, not the only trigger we see that we can do much about is going to be cow's milk. So sometimes it is worth avoiding and eliminating cow's milk from a cow's milk formula or exposure to milk for maybe a couple of weeks and see if their eczema gets a lot better. If it does, that doesn't prove that it was a cow's milk. Sometimes it just gets better. So what you then want to do is then expose them to a bunch of cow's milk over the next 2 or 3 days and see if it gets a bunch worse. If it does, cow's milk may be a factor. If it doesn't, it's probably not. In terms of nasal allergies, I think the most helpful thing is determining whether it's outside or inside. If your allergies are seasonal and they just occur at certain times of the year, here in Austin, in the spring it's oak, in the summer it's grasses, in the fall it's ragweed, in the winter it's cedar. If it just occurs at certain times of the year, that means it's something outside. On the other hand, if it occurs year-round, that usually makes it more likely it's going to be something inside, maybe dust or mold, or perhaps cats or something like that. And so sometimes those things will help you to diminish your exposure to those things. Keep in mind, you may not be able to totally eliminate exposure to things, but almost all allergies are quantitative. And by that, I mean how much of it makes a difference in terms of how much trouble you have with it. So if you have 9 cats and they all sleep in your bedroom, that's going to be a lot bigger problem than if you just have 1 cat that never goes into your bedroom. So we can do those things, and by limiting the exposure, that helps. The easiest example there is smoke. A little bit of smoke is only going to bother people with extreme sensitivity to the smoke. If you get enough smoke in the room, it's going to bother everyone. So eliminating is not always possible, but you can certainly reduce the exposure to those triggers. So that's eczema, allergies, and asthma in general and how they're related to each other. I hope that's useful. These 3 problems are so common that I think each one probably is going to be worth making a video to help you with each of those particulars, and I will do that. But in the meantime, I hope this helps you see how they're related.